All right, let's go ahead and get started. So welcome, good morning. Thank you for being here. My name is Katie and I work at the Sacramento Public Library where books are just the beginning. Thank you for joining us for Heart Health. And February is American Heart Month, a time to focus on your cardiovascular health. And the Sacramento Public Library has many tools to help you do just that. We are so happy to offer today's program to you and to have local registered nurses, Kim and Alicia, with us today. And we'll get to them in just a moment. But first, I wanted to mention a few things. So first is that all participants have been muted, so you can feel free to use the chat function at the bottom of your screen during the program should you have any questions or comments that you would like to share. If you're having any audio related issues, please exit the program and re-enter. Typically doing this will solve that problem. And if you need closed captioning, please click the live transcript button at the bottom of your screen. You'll wait just a second and then you'll see the closed captioning pop up and you can follow along. And I ask for your understanding in this virtual world that we are in. So if there are any technical difficulties during the presentation, say one of our presenters should lose connectivity, please just wait a few minutes and we'll see if they're able to rejoin and we can continue from there. So also, this program is being recorded and will be shared to our YouTube channel, which you can find under Sacramento Public Library. It'll be shared within the week, so you can look for it there. And make sure to check out our channel for a playlist of other helpful health programs. So let's go ahead and get started. With us today are registered nurses and Samuel Merritt University RN to BSN scholars, Kim and Alicia. I, for one, am looking forward to hearing some tips for how to care for my heart. So Kim and Alicia, please take it away.
Thanks, Katie. Welcome to Heart Health. I'm Kim. I'm a registered nurse with Roseville Kaiser Home Health. I've been a nurse for a little over 7 years. And then I'm here with Alicia. Do you want to introduce yourself?
Sure, I'm Alicia. I am also a registered nurse. I've been a registered nurse for 17 years. My current specialty is labor and delivery, although I have experience in other areas. And I am currently in the RN to BSN program at Samuel Merritt University. So we are so happy that you've joined us this morning. We know that there are plenty of reasons that you could be here, but we're just curious if you have a family history of heart disease. There are plenty of other reasons. You could just be here for wanting to take proactive measures for your heart health, this being Heart Health Awareness Month. But we are, whatever the cause, we're happy to have you. And we're going to go ahead and get started. First, we're going to do just a brief review of the cardiovascular system. It is the body's way of getting oxygen, nutrients all through the body, and also ridding the body of waste. Many of the problems with the cardiovascular system have to do with the slowdown or the blockage of the blood vessels, and we're going to talk more about that next. Some common cardiovascular problems include arrhythmias, which is an abnormal heart rhythm, heart attack, which is a blockage, heart valves that don't work correctly, and heart failure. There are also cardiovascular problems that affect the vessels, and that could be an aneurysm, which is a rupture of the vessel, stroke, which is a blockage, atherosclerosis, which is plaque buildup in the arteries, and vascular diseases. Those are diseases that involve the blood vessels. Our next slide just shows you the progression of heart disease. The first section is a cross-section of a healthy artery. As you can see, it is nice and round. There's plenty of area for blood flow. The next one shows a tear in the artery wall, which initially is a very small abnormality. But next, as you can see, the fatty material is deposited on the vessel wall because that tear actually attracts cholesterol and buildup in that area, which eventually can become a total blocked artery due to a blood clot and decreased blood flow, which can be the cause of a heart attack. The CDC reported last year in 2021 that 805,000 people suffered a heart attack in the United States. It is the #1 cause of death in the United States is cardiovascular disease. So our next slide just shows that blockage in the artery and the muscle damage that occurs from that. Kim, I'm going to turn it over to you to go over our heart attack symptoms.
Okay, thank you. So some symptoms of heart attacks. Not everybody gets every single one of these symptoms, and people may experience different symptoms, but these are the common ones. So chest discomfort, most heart attacks involve discomfort in the center of the chest that lasts for more than a few minutes or that goes away and comes back. It can feel like an uncomfortable pressure, squeezing, fullness, or pain. You might get discomfort in other areas of the upper body. So pain in one or both arms, the back, neck, jaw, or even the stomach. It may be accompanied with shortness of breath, with or without chest discomfort. And there may be other signs such as a cold sweat, nausea, or lightheadedness. There are also stroke symptoms. And there's an acronym called FAST. So you want to remember FAST. That stands for facial drooping. So if one side of the face is drooping or is numb, one way to test this is to have the person smile. And if one side of the smile doesn't go up or kind of falls down, that's a good indication. Arm weakness. Is one arm weak or numb? To test this, you can have the person put both of their hands out in front of them and hold it for a couple seconds. If one arm starts to fall down, that's a drift downward. That can show the weakness in the arm. And then speech difficulty. Is the speech slurred? Are they unable to speak? Are they hard to understand? You could just ask them to repeat a simple sentence like, "The sky is blue." And if they can't repeat that, or if it's slurred and you can't understand, if any of these symptoms are present, it's time to call 911. It's really important that you get them to the hospital immediately, because some treatments are time sensitive with a stroke. And then Alicia, back to you for some heart disease risk factors.
Sure. Before we go over the risk factors, I just wanted to pause and see if anyone has any questions. They can go ahead and enter those into the chat. All right, I'm going to go ahead and proceed with heart disease risk factors. Now that you know the symptoms and a little brief overview of the heart, we're going to go over what puts you at risk for cardiovascular disease. The #1 cause of is hypertension or high blood pressure. The force of the blood against the artery walls is high for high blood pressure, and that causes an injury to the vessels, and then that collection of plaque that eventually causes the blockage that we talked about in the previous slide. Unfortunately, hypertension tends to not have any symptoms, so the only way to know for sure is to have your blood pressure tested. According to the American Heart Association, blood pressure of less than 120/80 is considered in the normal range. 120, which is called the systolic blood pressure, the top number, it measures the force that your heartbeat has on the artery wall when it beats. So that's what the top number is. And the lower number, which is also called the diastolic, that is measuring the force of the force on the artery walls in between beats. So I'm going to repeat that because it came out a little confusing. But the systolic is the force of the beat, and the diastolic is during the rest in between the beats. So as you can see from that brief description, that force of the high blood pressure is what causes the injury to the arteries, which can lead to cardiovascular disease and a buildup of plaque on the arteries. Another risk factor is diabetes. Adults with diabetes are 2 to 4 times more likely to die from heart disease as people who don't have it. And the CDC reports that over time, high blood sugar can damage those blood vessels and the nerves that control your heart. So that is the reason that diabetes can cause a risk. One that many people are not aware of is depression. Adults with depression or symptoms of depression have a 64% greater risk of developing coronary artery disease. And that is because when you experience depression, anxiety, stress, your heart rate and blood pressure tend to rise. And that repeated rise in heart rate increases the blood flow to the heart and also increases your cortisol, or which is also known as your stress hormone. And over time, these can affect the heart. One that many are aware of is cholesterol. Extra cholesterol can build up on your artery walls and reduce the blood flow to the heart. As we all know, cholesterol is a fat-like substance. It's found in the body and is necessary for the body to work properly, but too much can be put you at risk. And there are different types of cholesterol. There is LDL, which is a fatty buildup in plaque, and then HDL, which is also considered a helper of cholesterol and helps rid the body of excessive cholesterol. So you should be tested to know your numbers on that. Lastly, obesity or being overweight is linked to several factors that increase the risk of cardiovascular disease, such as diabetes and high blood pressure that we've already discussed. Also, obesity tends to have a greater amount of blood flow in the body, and that extra blood flow causes your heart to have to work a little bit harder, and over time that can lead to heart failure. Next, we're going to talk about the prevention, so I'll hand it back over to Kim.
All right, thank you. And if you guys have any questions at this point, you can go ahead and put those in the chat as well. Okay, so things that you can do to prevent cardiovascular disease: stress management, healthy diet, quit smoking, physical activity, and getting better sleep. So we'll go into those more now. So stress management. Everyone feels and reacts to stress differently. How much stress you experience and how you react to it can lead to a wide variety of health problems. A stressful situation actually sets off a chain of events. Your body releases adrenaline, a hormone that temporarily causes your breathing and heart rate to speed up and your blood pressure to rise. And for what we've learned, the high blood pressure is bad. So these reactions prepare you to deal with the situation. So that fight or flight response. With chronic stress, it's when your stress is constant. So your body's in this high gear off and on for days or weeks or months at a time. And it may lead to that high blood pressure, which can increase that risk for heart attack and stroke. Managing your stress is good for your health and your well-being. And it can help reduce the risk for heart disease and stroke, and even death. So some ways you can manage stress is by exercising regularly. By exercising, it can relieve stress, tension, anxiety, even depression. Getting outside, going for a walk, doing meditation or yoga, those are things to help. Making time for your friends and family. It's important to maintain those social connections and talk to people that you can trust. Getting enough sleep, that can help with stress as well. Adults should aim for 7 to 9 hours a night of sleep. Maintaining a positive attitude, practicing relaxation techniques, listening to music, finding a hobby that's fun and can distract you from your negative thoughts and worries. So now we have a video. It's a little 5-minute mindfulness meditation. video. You can find these on YouTube if you just search for mindfulness meditation. They range anywhere from 5 minutes to 45 minutes, and they're a great way to just help you relax. So we're going to go ahead and play this. You guys can feel free to turn off your videos if you want and just listen along. So we'll go ahead and play that for you now.
To begin this mindfulness meditation, just let yourself get into a comfortable position, whatever that looks like for you. When your body feels ready, you may gently close your eyes. With your eyes closed, take a moment to tune inwards. First, simply noticing your body. Tuning into the weight of gravity, the points of contact between you and the surface on which you are resting. What else do you notice? What is it like for you to be in your body right now? As you observe this, you simply accept and allow whatever it is you notice, harboring no judgment, just being mindful, noticing what is with a sense of compassion in your heart and letting it be. Continue to do this now with your breath as well as your body. If you haven't already, begin to tune into the sensations of breathing. What do you notice? Just observe, accept, and allow. No judgment. Just letting everything be how it is. As you stay mindful of your breath and your body, with a sense of compassion in your heart. Keeping your eyes closed, you allow your awareness to expand to include the space around your body. It's as if you can sense the air around you, the objects around you, and you just allow them to be as you simply are. There's nothing to do, there's nothing to judge. If your mind wanders, that's okay. Don't judge it. Just return your focus to what is. Being connected to your breath, your body, and your sense of presence in the world around you. You let everything simply be, including yourself. You now begin to let your attention travel back, becoming more and more aware of physical sensations by rolling your shoulders, wiggling your fingers and toes, still being mindful of what is. and taking this present moment awareness with you as you slowly begin to open your eyes back to the world around you. Wonderful job doing this practice. We hope you enjoy the rest of your beautiful day.
Okay, welcome back. Hopefully everybody enjoyed that. So just listening to something like that or music just has a way of relaxing you and calming yourself, which can help with the stress. Okay, so a healthy diet. A healthy diet and healthy eating is an important part of healthy living. Eating a healthy diet reduces the majority of controllable risk factors for heart disease and stroke. So healthy food choices, fruits and vegetables, adding more color to your diet with those, getting whole grains, legumes, nuts, plant-based proteins, lean animal proteins, and fish. You could try to sneak vegetables into your meals for those that aren't big vegetable fans. Limit your sweetened drinks and avoid trans fats. On this slide, which I believe Katie's going to be sending you guys the slideshow, there is a link to different recipes through the American Heart Association. And they have some great suggestions, even for sneaking the vegetables into foods. And then the other one is to quit smoking. Smoking increases the risk for coronary heart disease as well as many other chronic disorders. If you already have heart disease, you might think, well, what good is it for me to do quitting smoking now? The answer is it can actually do quite a bit of good. Heart disease can be prevented and controlled by following your treatment plan, which includes quitting smoking. So this is how smoking can damage your heart. The nicotine, whether it's smoking, vaping, chewing tobacco, makes your heart and your blood pressure skyrocket, causing that hypertension. Carbon monoxide and tobacco rob your heart, brain, and arteries of oxygen. It then damages your blood vessels and makes your blood sticky, which is a recipe for those blood clots that Alicia talked about earlier in the blood vessels. It lowers your tolerance for physical activity, and it decreases the HDL, which is that good cholesterol that helps rid the bad cholesterol. So the good news is that when you stop smoking, your risk for heart disease and stroke can be cut in half in just 1 year of quitting, and it continues to decline until it's as low as a non-smoker's risk. And I know that smoking is a very hard habit to break, and so I put another link in there from the American Heart Association. This one's for 5 steps to quit smoking and vaping, but when you go onto that link, they have a bunch of other suggestions as well and resources to help you stop smoking. You can also talk to your doctor. And then getting enough physical activity to help make your heart stronger. It relieves the stress like we talked about. It reduces cardiovascular risk. It improves mood, which helps with the depression. It gives you energy and it helps with sleep. The American Heart Association suggests to try to get 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity each week. If you're already active, increase that intensity of activity. And if you're not active, go ahead and just start moving more each day until you can build up to those 150 minutes. And then better sleep. Getting better sleep can actually lead to a healthier you. Quality sleep can lead to better eating habits, mood, memory, internal organs, and more. Take naps. Put aside your electronic devices when you go to bed so you're not distracted. Dim your lights. We all set in the morning to get up, so set an alarm at night to remind you to go to sleep or to start a bedtime routine. put your phone on do not disturb at night so you don't get distracted or woken up by those text messages or calls from family members. And at the bottom of this slide, there is a YouTube link for the Sacramento Public Library for better sleep tips. It's a great source for that as well. And then Alicia, I'll turn it back over to you.
Sure. Next, I'm going to talk about the Sacramento Public Library Heart Health Resources. Thankfully, they have lots of things in their arsenal that can help you take great care of your heart. The first one being that they have blood pressure monitors available. It is important, like we said, the only way that you know that you have high blood pressure is to check it. So in between doctor visits, you can monitor your blood pressure. The blood pressure monitor kit includes an electronic blood pressure monitor, batteries, an instructional guide, and educational materials. You can check that out from the Sacramento Public Library catalog. Next, they have scales that you can have. There are limited supplies that will assist you in tracking your weight. It encourages you to keep your healthy diet and motivates you to incorporate a regular physical activity into your daily routine. There are pill organizers available that will remind you to take the right medication at the right time. It helps you to avoid medication mix-ups. And there are several medications that your doctor can prescribe to you to help to keep your heart healthy and to improve your cardiovascular system. That can be for high blood pressure, cholesterol medication, and many other things that can address your heart health. Lastly, the Sacramento Public Library has virtual classes. There is a virtual Zumba class that happens on Monday nights and a midday yoga class that is available. Those classes do require pre-registration, so go ahead and check out saclibrary.org for more information. There is virtual yoga available through the YouTube channel with plenty of videos on body positive yoga, veterans yoga, chair yoga, and just go ahead and click on the Sacramento Public Library YouTube page for more information on that, as well as music and mindfulness with Yo Remy and health education on plenty of other topics. Are there any questions that you have?
And again, feel free to use the chat function. If you have any questions at this time, we'll wait just a minute to see if anybody does. And Maria says, thank you for sharing info on other classes. Glad you enjoyed that. As Alicia said, we do have virtual Zumba that's happening on Mondays right now. We're about to start a midday yoga, and then we have tons of recorded programs that are available on our YouTube page, or you can go to saclibrary.org/health literacy, and you'll see all of our health related programming that we are currently doing or previous programs. What do I see? Oh, I do have a question here. How important is it to know one's resting heart rate? This is from Christina. So Kim or Alicia, do you want to take that?
Sure. So the normal range is 60 to 100 beats per minute. In excess of that, your heart could be working harder, and that, as we have discussed, could put you at risk for cardiovascular disease. It is preferred to have a resting heartbeat that is on the lower end. It just means that your heart is not working as hard. And there are plenty of ways to check your resting heartbeat. There are phones, Apple phone, I know for sure, does keep track of your heart rate. There are, you can just put your finger at your artery here or at your wrist to also check your heart rate. Are there any other questions?
Yeah, I think that's it for questions. You all have my email address. I put it there in the chat. If you want to follow up at any point, you can always feel free to do so. But I'd like to thank you all again for joining us for Heart Health, and a big thank you to Kim and Alicia for a great presentation. This was wonderful. I always appreciate the opportunity for any kind of meditation during the day to just feel that stress kind of melt away, even if it's for 5 minutes. It really does help and make, a big change. So we invite you to explore additional health resources in the Sacramento Public Library collection, including heart health books and DVDs. If you're interested in checking out a blood pressure monitor from our Library of Things, or if you'd like to receive a free pill organizer or scale, please feel free to email me at kball@saclibrary.org. And to find a library location near you, sign up for a library card, or to learn about upcoming virtual programs for all ages, just go to www.saclibrary.org. So for myself, for Kim, Alicia, and the Sacramento Public Library, thank you so much and be well. Bye.